What is surveillance for testicular cancer treatment? Imagine after your initial surgery to remove a testicle, your doctor wants to keep a close on you without jumping straight into more aggressive treatments. That's what surveillance for testicular cancer is all about. It's a carefully planned follow-up approach designed to monitor your health and catch any signs of the cancer coming back early. This approach is mainly used for patients with early-stage testicular cancer, especially when the risk of the cancer returning is low. Instead of immediately starting chemotherapy or radiation, doctors prefer to watch and wait, which can help avoid unnecessary side effects from treatments that might not be needed. Surveillance involves regular checkups that include physical exams to look for any new lumps or unusual changes. Blood tests are also a key part of this process. These tests measure tumor markers like human chorionic gonadotropin, alpha-fetoprotein, and lactate dehydrogenase. Elevated levels of these markers can suggest that cancer activity is returning or ongoing. Imaging studies are another important component, typically involving computed tomography scans of the abdomen and pelvis to look at the lymph nodes in the area where testicular cancer often spreads. Chest X-rays or CORT scans are used to check the lungs, which are common sites for metastasis. The most intense part of surveillance happens during the first 2 years after surgery, because the chance of relapse is highest during this period. During this time, physical exams and blood tests are usually scheduled every 3 to 6 months. Imaging scans are also done at regular intervals to catch any signs of recurrence early. After 2 years, the frequency of these checkups generally decreases because the risk of cancer coming back drops significantly. Some protocols might include low-dose CORT scans or magnetic resonance imaging to reduce exposure to radiation from repeated scans. The main advantage of surveillance is that it spares many men from the side effects of additional treatments like chemotherapy or radiation, which can have long-term impacts. However, it requires strict adherence to follow-up appointments and quick reporting of new symptoms. Early detection of recurrence makes treatment more effective and less invasive. Decisions about surveillance are personalized, taking into account the type of testicular cancer, whether it is seminoma or non-seminoma, the stage of the disease, tumor marker levels, and what the patient prefers. It's always important to discuss these options with your healthcare team to find the best plan for your specific situation. In essence, surveillance for testicular cancer is a proactive way to keep a close watch on your health after surgery. It combines regular physical exams, blood tests, and imaging to catch any signs of relapse early while helping you avoid unnecessary treatments. Always remember, staying committed to follow-up appointments and communicating openly with your medical team are key to making surveillance work effectively. If you have any concerns or notice symptoms, reach out to your healthcare provider promptly.